So my name is Philippe Armand and I work at Dana-Farber Cancer Institute in Boston. And the study that we did was using Nivolumab, which is an anti-PD-1 antibody in patients with relapsed refractory classical Hodgkin lymphoma. The reason that we did the study is that there was a lot of scientific background to suggest that classical Hodgkin lymphoma has a genetic abnormality that's quite common, and that gives it a genetically programmed dependence on the PD-1 pathway for survival. And so it made it an ideal target to test the PD-1 blockade strategy, which has been in extensive use so far in solid tumors mostly. So because of that, classical Hodgkin lymphoma was included as an independent expansion cohort in a phase 1 study of Nivolumab for patients with relapsed refractory hematologic malignancies. So we treated 23 patients with Hodgkin lymphoma using Nivolumab single-agent therapy, and what we found was that the response rate was 87% among the 23 patients, and those were patients who were very heavily pretreated with a median of 4 prior lines of therapy, and about a third of the patients had had 6 of prior lines of treatment. Almost 80% of them had had a prior auto transplant, almost 80% had brentuximab. This was a population of patients with quite advanced disease, and the response rate of 87% seemed like a very encouraging result. There appeared to be some durability in responses, so progression-free survival at 24 weeks was 86%, and a relatively manageable toxicity profile, which seemed to mirror that which we would expect from the solid tumor experience with this drug. We're very excited about it, and there's now a large phase 2 study to try to confirm those results. We're hoping that this drug will become an important part of the treatment arsenal for classical Hodgkin lymphoma.